Welcome to Chapter 5 of the Platinum Planner Preceptor Training Program. In this chapter, we'll talk about evaluation and feedback. There are 7 objectives to this chapter. The first 3 are to provide constructive and timely feedback to the clinical student, evaluating this clinical student objectively, being able to assign appropriate psychomotor levels of competency, referring to Bloom's taxonomy, avoiding common rating errors, differentiating between national and local standards and protocols, how to go about locating those standards in which to measure the student's performance, and then a willingness to close the feedback loop. Providing constructive feedback. When providing constructive feedback, one of the key things, and it's listed first, is to do so in a timely fashion. By timely, the quicker the better. If I were to say, last week or last year or 10 years ago you did this, and you really should have done that, you have no recollection of 10 years ago doing anything, so trying to correct it now is actually somewhat offensive. So instead, when a student does something, as quickly as you can, immediately after the call if you can, provide that feedback to the student. When providing feedback, relate it to a known standard. In the American Heart Association, we do 30 to 2 for compressions to ventilations. You were doing 60 to 2. So we need to interrupt at the 30 mark to get a couple of ventilations in. Make sure you're accurate. Make sure you caught those 2 that they didn't do accurately. And it would be foolish on your part to say, well, I thought you didn't do the 2. When providing that feedback, start with a positive, then a negative, then a positive. So we start with a positive, we go over the negatives in the middle, and we end with a positive. Feedback should be a positive experience overall. So you start off with, I really appreciated the way you did this or that, great job. I like to talk about some of the things that we could do better in the future. So it's not what you did wrong, it's what you could do better in the future. And then end with a positive. So this is what we're going to do, and remember, you did this very, very well. Another way to do it is allow the student to direct that feedback. How do you think that went? How did you think you did? And allow them to start it, which may be, and often is, negative and then positive. And always restrict it to 3 things you're going to correct. One of the challenges we often do is we try to correct way too many things. Just pick the top 3. When evaluating objectively, make sure it's accurate. Make sure it's based on a standard and not an opinion. If a student has done something unique that you've not seen before, ask yourself before you comment, did it violate a principle? Did it violate a standard? If it didn't violate a standard, or didn't violate a principle, even though it's not something you might do, it's not wrong necessarily. But if you say, well, I rather you do it this way, well, your rathering is more an opinion. So make sure it's accurate and based on standards. Bloom's taxonomy when it comes to the psychomotor domain. There are 5 levels typically referred to in Bloom's taxonomy. The first is being able to imitate. When a student arrives to your site, they should know how to do something beyond the imitation level. They should not have to watch you do something before they can do it. However, if it's something they've never seen before or a device they've never been exposed to before, imitation might be required. The next level up is manipulation. Manipulation is they don't have to watch somebody do it. They can do it, but they might make mistakes on the way or take forever to do it. The next level up is precision. Precision means they can do a task perfectly without error in a timely fashion. That's the level they're supposed to be trained to before they go to your site to practice. However, because they're nervous, because it's in a different situation, because they're being observed, they may regress to a manipulation level. So that's what you should really expect to see out of them. Though on the instruction side, we hope they're at a precision level when they go over there. Articulation is the ability to multitask. That's really where you'd like them to be able to get to, so that they can start IVs while doing other things, where they can bandage whilst talking to the patient. And then finally, naturalization level is the ability to do things without thinking of them. Prime example that's often used is tying your shoes. You don't think about tying your shoes when you tie them, you just tie your shoes. Naturalization is where we would like our students to get to eventually. We don't expect that necessarily to happen during a clinical setting. It's usually something that happens once they get out on the streets and start working regularly. Common rating errors: being subjective, using your opinion, being inaccurate, just you didn't observe properly. Being inconsistent. Today you said, hey, you really need to make sure you do this, and tomorrow it's not a big deal anymore. Saying, hey, you did a good job, or you did a bad job, but not saying specifically what was good or what was bad. And then finally, giving too much information. The number we restricted to is 3. National versus local standards. This is a common challenge that plays out. Remember, the students that we're preparing, we are preparing for national standards or a state test. We're not preparing them to work on the streets of your particular town. So it's the most difficult for the experienced preceptor to differentiate these because you're very well versed in your local standards. But you also have to know what the national standards are to be a preceptor. When local and national standards conflict, reinforce what the national standards are. Even though you may have to do the local standards, make sure you explain to the student, hi, locally this is what we do here, but remember nationally this is what you're going to do and what you need to know to get certified, registered, or licensed. So you need to know both standards. When in doubt, and a student says, no, this is what nationally we learn, trust but verify. By that, well, how do I go about verifying? How do I find what this clinical student standards are? One is on the web. You can just go to the web and type in EMT scope of practice. Look for the National Highway Traffic Safety Administration's website tag, and it'll show you what the EMT's scope of practice is. And that'll be for the first responder, EMT, AEMT, and paramedic. There's also an EMT educational standards. Again, just type that in and you'll find a link to this is what the educational standards are. This is what the student's supposed to know. And then you can also go to the National Registry, and there's an area where you can download the skill sheets to show how a student's supposed to be able to do something. One of our best sources, though, would be the school. The school should have access to, or provide you access to, here's what we expect our students to be able to do and how we expect them to be able to do it. And hopefully one day, very soon, Platinum Planner, you'll be able to go to and look at the skill sheets and say, this is what the school wants us to do. In closing that feedback loop, when a student finishes something and you're going to provide that reinforcement, check for their understanding. Now, a lot of times people say, did you understand what we talked about? And they'll say yes, but not really understand. They just, yes, I don't want to talk about it anymore, let's move on. So instead of asking, do you understand? Ask what they understand. Ask, what did we just go over in feedback? What were the 3 critical things we needed to focus on? And have them tell you. Finally, key aspect of closing the feedback loop, though they say they understand it, though they can talk it, remember, talking the talk isn't the same as walking the walk. So ask them to demonstrate or watch the next time they do it. Did they make the changes? Did they internalize that feedback and actually change their behavior? That will be the final aspect of closing that feedback loop. So again, evaluation and feedback, we talked about providing that feedback in a timely fashion to make sure it's positive in nature. We talked about evaluating the student objectively, in other words, not our opinion, and accurate. We talked about the 5 levels of Bloom's taxonomy, lowest being imitation, next being manipulation, which is really what we expect the student to be at when they first arrive at our site. Precision, done perfectly, what the school hoped they sent to you, and where we will get them to within our program. Next would be articulation, multitasking, and finally naturalization, the ability to do it without thinking about it. We talked about common rating errors, inaccuracy, subjectivity, and consistency being nonspecific or providing too much. We talked about the difference between national standards and local protocols, and that as a preceptor, we need to be focused on what the national standards are with our students, even though while doing the task we may have to follow local protocol. We talked about where to locate these standards, that the best was the school, but also there are areas that you can go and search on the web. And finally, a willingness to close that feedback loop, which basically means have the student provide what did we talk about, and then watch, especially, for them to demonstrate a correction in behavior in the future. This concludes Chapter 5. Thank you.